Very excited to have my guest joining me on the Fuzzy Mic today. When the social distancing and the shutting down of cities and states and basically this country, when it first started, I reached out to this gentleman and we had a call lined up, and then all of a sudden he had to cancel. And it's understandable because when CNN, Fox News, ABC, CBS, NBC, MSNBC, CNBC, all of the big news agencies reached out to this guy because he is a leading expert in vaccine development. He practices at Texas Children's Hospital, and he's also the dean of Baylor College of Medicine. He's considered one of the most trusted experts on COVID-19. He is the world-renowned vaccine development doctor, Peter Hotez. Dr. Hotez, are you there?
Yes.
Hi, Dr. Hotez. It's Kevin Klein.
Hey, Kevin, how are you?
I'm very, very excited. An absolute pleasure to speak with you. And I just want to jump right on in. Are we moving too fast with opening up not only Houston, but the country?
Well, that's the big question, right? I mean, first of all, let's talk about the good news. The good news is that the city of Houston implemented social distancing pretty early on in the game, meaning that even before the virus was here in a big way, we implemented social distancing because we saw what was going on in New York and New Jersey. So Houstonians can feel really proud of the city leadership that we got ahead of this. And so far, it looks like there's not been a big surge in hospitals, in our intensive care units, like we've seen in other places in the country. That the difference to whether you have 2,000 ICU beds filled up in your city versus 20 has to do with how quickly you implemented social distancing. So if you allowed transmission to go on for 6 weeks, you faced a disaster like we're seeing in New York City or Wuhan. If you got on top of it early, then you made great public health strides and saved lives. And I think we're going to be in that latter category. So I think Houstonians can feel pretty good about that. So that's point one. I think point two is some of those same models say in order to finish the job and go back to a containment strategy, meaning preventing a new epidemic from starting, we need to carry out this social distancing till June 1. And the problem is the minute I even mention a whiff of anything with the words June 1 in it, I get immediately a lot of pushback because there's so much economic pressure to open things up sooner. And I totally get that, and I agree that we can move partially in that direction. Then the question is, how do you strike a balance? How do you work out what's actually doable and what will continue to protect public health? And there, I think we still don't have the full picture yet. But I do think we need a more complete to implement a more complete program of public health in terms of not only diagnostic testing, maybe in the workplace, but contact tracing, maybe doing something called syndromic surveillance. We have to now use this time to fully implement a very aggressive public health plan.
Now, going back to one of the first things that you said in step one, you said that Houston in particular, because we shut down social distancing so early, and the state of Texas could be doing okay. We are last in the country in testing capability. So with asymptomatic symptoms, how do we know, and the lack of testing, how do we know that we're not conversing with somebody who might have the virus?
But you don't. But the reason I have some confidence that we're doing well, because you're absolutely right. Well, we're not dead last. Don't embellish. We're 49th.
49th, okay.
I think the fact that I think that I can say with some confidence that we're doing well, at least in Houston, is the fact we're not getting overwhelmed in our ICU beds. Because, that's the one thing you can't hide, right? You can't, although we could say that we have not fully captured the number of cases here in Texas by diagnostic testing. I think that's absolutely true. There may be easily 10 times higher the number of cases than we're actually reporting. I do think the fact that we're not seeing a big surge on our ICUs is probably reflective of the fact that we have benefited from that early social distancing.
Your expertise is vaccine development, and I have heard you go on record that it's 12 to 18 months away before we get a viable vaccine. However, I read something that you said the other day that just blows me away. That would be a world record because it's not even close to what the normal time is for a vaccine to be approved.
Yeah, that's right. So, our challenge, our charge from Dr. Fauci is to do this in a year to 18 months, and it's all hands on deck trying to do that. But it would break a world record given the fact that the usual time frame is measured in many years, not in months. Is it possible to do it? We're going to certainly try, and maybe there's some more things we can do in parallel rather than serially. But I think the point is, in our plans for opening up the state of Texas and the country, we have to have two plans, Plan A and Plan B. Plan A, in case we have the vaccine ready, but we have to have a very sound Plan B for if it's not.
I read this going back to 10 years ago with the original SARS. It wasn't COVID-19, it wasn't coronavirus, but you actually had developed a vaccine that lost funding.
Well, it didn't lose funding. We had funding, and we moved it all the way along to manufacture. Then we had trouble getting other people to bring in new funds to move it into clinical testing. So now we're trying to do that at this point.
If we had that, would that play a role in today?
I think so, because we're looking at that vaccine to repurpose to prevent this SARS-2 epidemic.
Now, you're also a proponent of convalescent plasma.
Mm-hmm.
Did I get that right?
Yeah, this is taking serum or plasma from patients who've been infected with the virus and then recovered, and then they have antibodies, and that could be used. Those antibodies can be harvested from patients and used as a therapy, and that's being done now at a couple of hospitals in the Texas Medical Center.
So is that a therapy or is that a cure?
That's a therapy. Well, it's similar, right? It's basically treating the patient who's already sick.
How do viruses start?
Well, viruses start in many different ways. Some are viruses that are transmitted from animals to humans. Others have been circulating in humans for centuries, and we have new epidemics. And for COVID-19, we know coronaviruses circulate commonly among bats. Actually, coronaviruses are not the only one to do this. Ebola does this as well. So bats are a natural reservoir for many different viruses. And at some point, this virus likely jumped from bats to humans, or maybe through another intermediate animal, and through a combination of evolution and mutation of this virus that then became suitable for human-to-human transmission.
Dr. Hotez, you just said the word mutation. How are viruses capable of mutating to where they become kind of resilient to a particular treatment?
Well, I think you're sort of mixing and matching a couple of things there. Viruses mutate all the time. In this case, it's an RNA virus that has a pretty high mutation rate, although this COVID-19 virus seems to be not as high as other RNA viruses. I do not think mutation is a big factor in from going forward from now for this virus. I think, the mutation event that allowed it to jump from animals to people, if that was the case, it has already happened. And the other reason that you get concerned about mutation is for something like HIV/AIDS virus, where that does undergo mutation and that becomes resistant to antiviral drugs. But for this virus, I don't think we have to worry so much about mutation going forward as I would other viruses.
Can you take us through the process of how you develop a vaccine?
That's a lot. I mean, that's a 2-hour question. 2-hour answer. I'll just say that there's many different strategies that use approaches ranging from inactivating the virus to weakening the virus to using a component of the virus, what's called a subunit vaccine, to using part of the RNA of the virus. And in our case, we've made this as a recombinant protein subunit vaccine.
What does that mean?
Well, this means we took a part of the virus that encodes the piece that allows the virus to bind to its receptor and genetically engineer it into either bacteria or yeast. And for this vaccine, we've used yeast. The protein gets expressed. We isolate the protein, And now we've shown that this is a very effective vaccine in laboratory animals infected with the virus.
When the vaccine gets finalized and approved, will we have to get this annually like we do the flu shot?
I hope not. I don't think so. I think this might be one where you may have to just give it every few years, unless there's a big change in the virus. But I think maybe this would be something that could last a few years, which would be great.
How hard are you working right now?
Oh, there's no sleep in the last few months. So up early and then going to bed late on teleconferences, trying to get our vaccine into clinical trials. On top of that, also working very hard to raise the funds we need to move this into the clinic.
Now, I know that you worked closely with the Obama administration. Are you in contact with President Trump and Dr. Fauci and Dr. Birx about what you're finding?
We're certainly in contact with the National Institutes of Health and BARDA and those organizations. I have a long-known Dr. Fauci, for 40 years. He's a friend and mentor. I'm trying not to bother him now because it turns out he's got a fair bit on his plate.
Yeah, a little bit, right?
Yeah.
So your expertise is helping impoverished countries come up with vaccines for things that that they face that we already have kind of a handle on here. How hard are, third world countries going to be hit with COVID-19?
They're going to be hit very hard, I predict, unfortunately. This virus starts racing through the southern hemisphere in the summer months, which I'm worried about. I'm very concerned, especially in the crowded urban areas where it's very difficult to enact social distancing. That's going to be a real issue in places like the urban slums of Indian cities like Mumbai or Calcutta, or going to Bangladesh and Dhaka, or going into Lagos in Nigeria, or Kinshasa and Congo, or some of the Latin American cities where you have big slums like Sao Paulo or Rio. So, yeah, I'm extremely worried about that.
What can we do to protect ourselves?
Well, a few things. We're doing several vaccines, and I think ours will be particularly useful for purposes of global health. In the meantime, the social distancing is going to be really important in listening to our public health leaders about how we do this.
It is no easy task, but we are behind you 1,000%, you and your team, Dr. Hotez. Thank you so much for joining us today, giving us your insight, and for making us feel a little bit more calm than what we did before you were on with us.
Yeah, I think the good news is, we've done the right things here in Houston, and now it's figuring out how to make the next chess moves and make them in the right way, which both balances helping the economy without jeopardizing public health. And it's a tough balance.
It's a very, very tough balance. I'm glad I'm not in charge of anything about that because, man, I can't imagine how that's got to be weighing on the governors and the president and the lawmakers. So much success to you, sir. Thank you for doing everything that you've already done for this world and that you continue to do.
Thank you. All the best.
That's Dr. Peter Hotez, one of the deans of the Baylor College of Medicine. Unbelievable responsibility that he has and that his team has. It is nice to hear a calm voice from someone who is at the forefront of this fight. I want to thank Dr. Hotez for joining us on the Fuzzy Mike. Also, I want to thank Douglas Soriano at Texas Children's Hospital for helping facilitate that interview. The Fuzzy Mike executive producer is Trish Klein, social media director Lisa Tynan, production elements Zach Sheesh at theradiofarm.com. I'm your host, Kevin Klein. Don't forget to follow us on Facebook, Twitter, Instagram, YouTube, and on the website, www.thefuzzymike.com. We'll see you next time on The Fuzzy Mike.
Thanks for listening to this episode of The Fuzzy Mike with Kevin Klein. Check back often and stay fuzzy, friends. Fuzzy Mike is a presentation of the Kevin Klein Fuzzy Mike Industry, Incorporated, LLC.